Hi, nice to see you again.
Hey, Dr. Struhl, how are you?
Good, have a seat. I just wanted to tell you what's going on with your knee. We got the MRI results back.
Okay.
And the problem is you have some damage on the kneecap. People call it chondromalacia. And what that is, looks like this. This is a normal knee.
Right.
And see, the kneecap surface should be perfectly smooth.
Right.
And when you bend the knee back and forth, it should be nice and smooth. But your MRI shows and your exam shows that this area is very damaged. That's why when you're squatting or biking, you're having a lot of pain. Your MRI shows the damage is very high up.
Okay.
So if we can get some new cartilage to cover that, so we're trying to build that up as much as we can.
Okay. I am a general contractor. My knee got to the point where it was affecting my ability to work on a regular basis. I couldn't carry heavy objects or bring things to the job site. Anytime I put extra weight on the knee, it really gave me a substantial amount of pain, and I couldn't bend down as well. I was unable to continue with the sports that I like to do, my running and my training. I do a lot of bicycle riding, and it affected it to the point where I could not run anymore, and it got so bad that I was having trouble standing up and just walking on a regular basis. I had a lot of debris in the knee, and arthritis built up, and it was worn down from overuse, and they went in there and they cleaned all that out. There's always a little fear involved when you're going to go into some sort of a surgery, but after my consultation with Dr. Struhl, I felt very comfortable. He explained everything, and by the time the actual surgery came around, I was very comfortable going into the surgery with him, and he exudes definitely an air of confidence that makes you feel good about what you're going into, that he knows what he's doing, and so I felt very good about it. The outcome was great. I was walking that day and was really not uncomfortable at all after the surgery. After I was driven home from the surgery, I relaxed for a little while, and then I actually got up, went to work. I worked for the rest of the day, and that night we ended up having a function that we had to go to, so I ended up going out that evening. I met a few friends, and I even ended up dancing for a little bit that night. I've gotten to the point where I'm back up and training. I was very pleased with the way my right knee went, and with the surgery, everything went so well that I'm actually having surgery done on my left knee, the same exact surgery done later on today. Dr. Struhl was very accessible to me. At the surgery, he had given me his cell phone number, and I always had his email address, so I was able to call him the weekend after. I had a question about my knee, and he was right there on the cell phone for me, and I was even able to text him a few times, and he got back to me very quickly. So I would say he was very accessible. I was very surprised that he gave me his cell phone number, because I don't really expect that from a doctor. I ended up having my procedure done at Westchester Ambulatory Surgical Center, which is in Westchester on Westchester Avenue, and I thought the facility was great. It was relatively small, but I went in there and I was in and out very quickly. I live right in Westchester. Dr. Struhl did give me the option of coming to Manhattan or having it done there, and I chose there, and I was very pleased with the facility. I would absolutely recommend Dr. Struhl to my friends for knee surgery, most definitely. And as a matter of fact, I was on a bike ride over the summertime, and one of the guys who we were riding with went over the handlebars, and he separated his shoulder, and it was a Sunday morning, and we didn't know what to do, and he was pretty banged up. I ended up calling Dr. Struhl because he had given me his cell phone number. And he met us at the hospital, and he scheduled him for surgery later in the week. He repaired his shoulder, and we are out bike riding again. He's in great shape. I would like to thank Dr. Struhl for repairing my knee and getting my life back on track. I feel that he did a wonderful job with my knee, and I'll be able to work hard and train hard, and I'm excited to get back to my life.